We saw this case for the first time at 18 weeks and 5 days. At that time we noticed the stomach on right side and the heart was tilted to the left side. We noticed the position of the aorta was a little to the left and aorta and the position of IVC was not very clear. We noticed the large ASD as well. We asked the patient, because of the position and odd imaging, we were not clear about the diagnosis. We asked the patient to come after at 28 weeks. But the patient, at that time we noticed the position of the stomach was on the right side and the heart was tilted to left side, and there were two vessels in the 4-chamber view which were noticed, and that was aorta and the azygos, confirming the possible diagnosis of left isomerism. And so there was a visceral situs and the possible diagnosis of left isomerism which was confirmed. Large ASD was noticed, and we were suspecting something wrong with the large VSD as well as the possibility of a position of the AV valve at the same level. So we started seeing in the detail, and we noticed the persistent left superior vena cava with a dilated coronary sinus, a large ASD, a VSD, and both the valves, atrioventricular valves, at the same level with the disproportion of the ventricles which were visible. And when we looked at the outflow tract, the first vessel to come out was this pulmonary, which was dividing in two. Immediate second vessel was a boomerang shaped, and that was aorta, and that's the persistent left superior vena cava which was visible on the left side of the aorta, and that confirmed our diagnosis of left isomerism with persistent left superior vena cava with incomplete AVSD, with large VSD, and the dextro transposition of the great vessels which were noticed. And the Doppler sonography at the level of abdomen showed us two vessels which were running parallel. The vessel which was showing the flow downward from the heart was the aorta, and the another vessel parallel was azygos. Normally the inferior vena cava is anterior and quite away from the descending aorta, while here both the vessels were running parallel, and the azygos which was taking place of the role of IVC was posterior to the aorta, and it was showing the upward flow, that means red color, which was visible. So this confirmed the interruption of the inferior vena cava and drainage of this azygos vessel into the superior vena cava on the right side, which we confirmed on our